It is Wednesday, January 21st, 2026. And, you know, if you take a walk through downtown San Francisco or look at the latest quarterly reports coming out of Wall Street, everything looks gleaming.
Gleaming is a good word for it.
Right.
Yeah.
We've got AI optimizing our grocery lists. We've got these towers that twist into the clouds. And the stock market is projecting this image of just infinite efficiency.
It's a beautiful facade. I mean, it really is. It's like this high-tech ship just sailing smoothly on completely calm water.
Exactly. It feels like we're living at the absolute peak of civilization. But today, we are going to go down into the engine room. We're going to look at the hull of this ship.
Mm-hmm.
And according to the deep dive we're doing today, and this is based on a stack of research that is, frankly, a little terrifying, the hull is not just leaking, it's rotting.
Rotting is absolutely the right word, because we aren't talking about a sudden crash, like a stock market event. We're talking about a slow structural decay. We're essentially auditing the United States today, and we're looking specifically at three massive pillars: healthcare, defense, and our fiscal management.
And the core argument that's in front of us is that all three of these are now entangled in what the source calls a toxic triad.
A toxic triad of fraud, inefficiency, and just deeply misaligned, or what they call perverse incentives.
And what I love about this particular set of research, this source, is that it doesn't just stay in the spreadsheet. It doesn't just, bore us with rows on Excel. It pivots to history.
It has to.
We're going to be talking about the Soviet Union, the Mongol Empire, and ancient Rome.
Which might sound like a strange dinner party guest list, but, it's necessary. When you're dealing with the numbers we have today, and we're talking about trillions of dollars, not billions, the human brain it kind of shuts off.
Yeah, it's just a word at that point.
It is. You can't process it. History gives us the map. It shows us what happens when great powers let their internal operating systems fail.
So here is the mission for today's deep dive. We're going to audit America's dysfunctional pillars. We're going to start with what the source calls the Soviet-style maze of American healthcare.
Which is a heck of a phrase.
It is. Then we'll move into the black hole of the Pentagon's finances.
Mm-hmm.
And then we're going to tackle a debt bomb that is ticking at a rate that, I'm not kidding, it actually made me check the math twice.
I did the same thing. And just to clear the air before we dive in, this isn't a political hit piece. This is not a left versus right thing.
Well,
the research really emphasizes that these are systems engineering failures. It's about mechanics, not ideology. It's about how the machine is built.
Okay, let's get into it then. Let's unpack this. Pillar number one, healthcare. The research explicitly draws a comparison between the current U.S. healthcare system and the Soviet bureaucracy of the 1980s. Now, I have to stop you there. That feels aggressive. I mean, we have advanced technology. We don't have bread lines. It's calling it Soviet, just, hyperbole to get clicks.
It sounds like hyperbole, and I thought so too at first. But if you look at the org chart, it's not comparing the quality of the medicine. It's not saying your doctor is a Soviet apparatchik.
Yeah.
It's comparing the layers of the administration. The Soviet system was famous for this, for having layers upon layers of paper pushers who existed solely to verify the work of other paper pushers.
Right, a bureaucracy for the sake of bureaucracy.
Exactly. It was an administration that multiplied costs without producing a single extra loaf of bread, or in this case, a single extra positive health outcome.
Okay, so it's about administrative bloat. It's a structural comparison, not a quality one.
It's a labyrinth. And to understand the labyrinth, you have to look at the money. We're approaching annual spending of $4.3 trillion.
$4.3 trillion.
And that's nearly 18% of our entire GDP. But the number that really matters here, the one the source flags, isn't even the total spend. It's the leakage.
Leakage implies a drip. This looks more like a fire hose.
It's a geyser. Estimates suggest that up to 10% of that massive sum is lost strictly to fraud and abuse.
Okay, let's contextualize that, because those numbers are just their words. 10% of $4.3 trillion is $430 billion.
$430 billion.
That's more than the entire GDP of most countries on Earth. Just what? Vanishing into thin air every single year.
Vanishing, siphoned off. And it's not just, someone stealing cash from the register. This is sophisticated systemic extraction. And to get it, we really need to talk about the mechanics of how this happens. Specifically things like upcoding.
Upcoding. It sounds like tech jargon. What does that actually look like in a doctor's office or a hospital?
Okay, so imagine you take your car to a mechanic for a simple oil change. It takes 20 minutes, it costs $50. But when the mechanic sends the bill to your insurance company, He writes down that he didn't just change the oil, he rebuilt your transmission.
Oh, wow.
That's upcoding. A more complex, more expensive procedure is billed than what was actually performed.
So the patient, or the car, in your example, gets the basic service. But the system, the insurer, the government, gets billed for the premium package.
Exactly. That's one way. Or they bill for ghost services. Services that literally never happened, a consultation that wasn't had, a test that was never run. They exist only on the invoice.
So it's just pure fabrication.
Pure fabrication.
Yeah.
But the most insidious one, the one that really gets to the Soviet comparison, is the recommendation of unnecessary treatments.
Why is that the most insidious?
Because it's not just about money anymore, it's about a person's health. This is where the system recommends scans, tests, procedures, not because the patient needs them to get well, but because the system needs to bill for them to stay solvent. It's activity for the sake of activity.
It's the hamster wheel model of medicine. Just keep running.
And it has a name. We call it fee-for-service. And it rewards volume, not value. Think about that incentive structure.
Okay.
If you are a doctor or a hospital in this system, you are financially penalized for curing someone quickly and efficiently. You make less money.
Whereas you're rewarded for managing their sickness over a long period of time with as many interventions as possible.
Precisely. The sicker the population and the more treatments they need, the more profitable the system becomes. It's a feedback loop.
And the research highlights Medicare Advantage specifically here, right? There's something about risk scores. This seems like a new level of gaming the system.
This is a huge scandal that, for some reason, just flies under the radar for most people. Insurance companies that run these Medicare Advantage plans are accused of systematically inflating patient risk scores.
Okay, what does that mean? What's a risk score?
It's basically a number that tells the government how sick a patient is. The sicker the patient, the higher the risk score, and the more money the government gives the insurance company to manage that patient's care.
So they get a bonus for taking on sicker patients.
Precisely. So what do? They scour the medical records, they send people to members' homes, and they look for any code, any diagnosis, no matter how minor or resolved, that can make a patient look sicker on paper than they actually are.
So a healthy 70-year-old who had, I don't know, a minor condition a decade ago could be coded as a frail, multi-morbid, ticking time bomb on paper.
And that's exactly what the allegations are. And for that, the company gets a bigger check from the Treasury. It's a game of data manipulation that costs taxpayers billions and billions of dollars.
And it does absolutely nothing to improve the health of that 70-year-old.
Zero. It's pure profit extraction from the system. It's gaming the algorithm.
The Medicaid has its own version of this, right? The open-ended federal matching thing.
Yeah, this one is a little more subtle, but just as corrosive. The way it works is if a state expands its Medicaid coverage or creates more administrative layers, the federal government just matches the funds. No questions asked.
So there's no incentive for a state to say, hey, let's make this more efficient.
There is a disincentive. If they make it more efficient, they get less money from the federal government. The system literally rewards the growth of the bureaucracy itself. The bigger your bureaucracy, the more federal dollars you get.
It's unbelievable. Okay, so we have a system that bleeds money through fraud, that's incentivized to keep us in the system, and that rewards bureaucratic bloat. But here is where the deep dive took a turn I really was not expecting. I thought we were just going to talk about billing codes and audits, but the research pivots to biology, to the gut.
This is the most critical part of the analysis, I think. You cannot talk about the cost of the healthcare system without talking about the demand for it.
Why are we so sick in the first place?
Exactly. Why do we need $4.3 trillion worth of care? And the answer isn't just we're getting older, though that's part of it.
No.
The answer is that we are being biologically compromised on a population level. The stats are just, they're undeniable. Over 40% of U.S. adults are now classified as obese.
40%. And the standard narrative we always hear is, oh, people just need to exercise more, or it's a lack of willpower.
Right, the personal responsibility argument, just put down the donut. The research says that is scientifically lazy and, frankly, wrong. This isn't just about individual choice. This is an environmental and biological issue. We are consuming a diet of industrialized, corporate-produced food that is fundamentally altering our gut microbiome.
Okay, I want to drill down on this, because microbiome is a buzzword we hear a lot now. What is actually happening down there, according to the source?
Think of your gut and the bacteria in it as a complex chemical factory. Trillions of little workers.
Okay.
In a healthy person, that factory processes food, it takes the nutrients it needs, produces helpful compounds, and it passes the rest. But when you flood that factory with a constant stream of processed ingredients, emulsifiers, seed oils, and high fructose corn syrup, you change the workers in the factory.
You're not just changing what they work on, you're hiring a different crew entirely.
You are hiring a crew that is hyper-efficient at energy extraction. This is the key insight. The altered types of bacteria found in an obese individual's gut actually extract more calories from the exact same amount of food than the bacteria in a thin person's gut.
Wait, let me get this straight. So if you and I eat the exact same burger with the exact same number of official calories, but my gut biome is compromised by years of eating processed food, I will literally absorb more calories from it than you will.
That is what the science is showing. Yes.
Yeah.
It fundamentally changes the equation. It turns your body into a caloric trap. It impairs your metabolism. So the old simple model of calories in, calories out breaks down.
Because the calories in variable is being manipulated by the bacteria itself. You're getting more in than the label says.
You are. And this creates a state of chronic, low-grade inflammation throughout the body, which is the precursor to almost every chronic disease that costs our healthcare system so much money. Diabetes, heart disease, even some cancers.
This connects everything back to the toxic triad. You have an agricultural and food system, often subsidized by the government, by the way, that produces cheap, hyper-palatable processed food.
That's right.
That food alters the biology of the population over decades, making them chronically sick and metabolically broken.
Which then feeds them directly into the first pillar we discussed, the healthcare system.
A system which is designed not to cure that chronic sickness, but to manage it for maximum lifelong profit.
It's a perfect loop, a loop of misery and money.
And it sidesteps the whole personal responsibility argument. It's not about willpower when your very biology is being hijacked.
It's a systemic failure. The research points to urban design food deserts, socioeconomic conditions, the constant advertising, the availability. It all funnels people into this metabolic trap, and until you fix the food, you can't fix the healthcare costs. You're just bailing water out of a sinking boat while someone else is drilling holes in the bottom.
That is incredibly heavy. Wow, okay. We have to keep moving. We've looked at the Soviet maze of healthcare. Now let's look at pillar number 2. The research calls this one the black hole.
The Department of Defense.
Now, everyone knows defense spending is high. We see the jets, we see the carriers. The budget is over $800 billion annually. But this isn't about the size of the budget, is it? It's about knowing where the money actually goes.
It's about basic accounting, the kind of accounting any small business in America is required by law to do.
Okay, so what's the headline here?
Here is the headline that should be on every front page every single year. As of 2025, the Pentagon failed its department-wide audit for the 8th consecutive year.
8 years in a row. If I'm running a coffee shop and I fail my audit 8 years in a row, the IRS shuts me down and I'm probably going to prison.
And if you're the CEO of a publicly traded company, the SEC is knocking on your door immediately and shareholders are suing you. But this is the Pentagon. They cannot verify trillions of dollars in assets.
Trillions with a T.
Trillions. We're talking about buildings, ships, tanks, ammunition, spare parts.
What does a failed audit actually look like in the military? I mean, are we talking about missing receipts for office supplies here, or is it bigger than that?
It is so much bigger. We are talking about literally missing warehouses. We are talking about what the report calls outdated systems, some of which still rely on 1980s coding languages like COBOL that can't talk to each other.
So the Navy's computer can't talk to the Air Force's computer.
The Navy's computer in one shipyard can't talk to the Navy's computer in another. So you have one system that says, we have $10 million worth of spare parts for the F-35 fighter jet in this warehouse in Utah. And an auditor goes to the warehouse, and the shelf is empty.
Wow.
Or worse, the shelf is full of those parts, but the computer system thinks it's empty, so it automatically orders $10 million more of the same part.
That is the black hole. It's not just money going out. It's that you have no idea what's even in there.
None. And a system this opaque, it doesn't just create waste, it invites fraud.
Right.
The research documents that between 2017 and 2024, the amount of confirmed fraud reached $10.8 billion.
And that's just what they caught. The stuff that left the paper trail.
That is the tiny tip of a very, very large iceberg. We see contractor overbilling, the classic stories of a bolt that costs 50 cents at a hardware store being billed to the government for $50.
The $1,000 toilet seat.
Exactly. We see inefficient management of spare parts, like we just discussed.
All right.
But one of the biggest categories is lost property. Hundreds of millions of dollars in government-owned equipment, from laptops to vehicle parts, provided to contractors that just vanishes. It's written off as lost.
So the question I have, and I think the listener might have, is does this matter beyond just the wasted tax dollars? I mean, obviously, I hate seeing my money burn, but is there a strategic risk here, a national security risk?
It's a massive national security vulnerability. This is the core point the source makes. Logistics wins wars. History is very clear on that.
Okay.
If you don't know what you have, you don't know what you can deploy. If you can't track your inventory of missiles or jet engines or even basic medical supplies, how do you sustain a conflict? How do you plan for a future one?
You can't. You're just guessing.
The research argues that this opacity isn't just bad accounting. It's a fundamental blind spot in our defense capabilities. We are effectively flying blind in our own supply chain. It's the Soviet military-industrial parallel all over again. A massive budget that masks incredible brittleness and waste underneath.
Was there any good news in this section of the research? Or are we just totally in the dark across the board?
There was a tiny glimmer of hope. The Marine Corps.
Oh, really?
They recently passed an audit. They are the only branch mentioned in the files to have done so.
Semper Fi. So at least the Marines know where their trucks are.
They do. And there are, promises from the DoD for full compliance by 2028, but the research describes the progress as lagging significantly. The culture of the military-industrial complex is just very, very resistant to this kind of transparency.
Okay, so we have a healthcare system that is a labyrinth of perverse incentives, making us sicker and poorer. We have a Defense Department that literally can't count its own assets. Now, we have to talk about how we pay for all this. Pillar number 3, the debt bomb.
This is where the numbers stop sounding real at all. They become almost abstract.
So set the scene for us. It's January 2026. What is the damage?
The total U.S. national debt as of this month stands at roughly $38.5 trillion.
$38.5 trillion? I feel like if I tried to visualize that in dollar bills, it would, I don't know, reach the moon or something.
It's a useless exercise. Let's look at the velocity, because that's what really matters. The rate of change.
Right.
The debt increased by $2.25 trillion in a single year. That's from 2025 to 2026.
$2.25 trillion.
Yeah.
In 1 year.
So if you break that down, the U.S. debt is growing by about $8 billion every single day.
$8 billion a day. So in the hour or so it takes us to record this deep dive, the U.S. government has borrowed a third of $1 billion?
Roughly, yes. $333 million an hour. We are borrowing from the future at an incredible rate just to keep the lights on today.
And there's a cost to that borrowing. It's not free money from a magic money tree. There's interest.
The interest. This is the trap. The source calls it the doom loop. In fiscal year 2026, the interest payments alone on the debt are consuming nearly 19% of all federal spending.
19%.
Yes.
So let's make that real. Almost 1 out of every 5 tax dollars that you send to Washington isn't buying a road or a school or a tank or a doctor's visit.
Nope.
It's just paying the interest to the people who lent us money in the past. It's servicing the credit card bill.
It's paying for the past. And that percentage is climbing fast. As interest rates rise and the debt grows, that slice of the pie gets bigger and bigger. This is called crowding out.
Crowding out was?
Everything else. As that interest slice gets bigger, the slice for everything else, essential services, emergency response, infrastructure, science, you name it, gets smaller. We are squeezing our own ability to govern because we are shackled to these interest payments.
And the drivers of the deficit, the reason we're borrowing so much, it isn't just one thing. It's not like there's one program we can cut and fix it all.
No, it's structural. It's the growth of entitlements like Social Security and Medicare as the population ages. It's the rising interest obligations we just talked about. And it's decades of just unfettered borrowing by both political parties. We are now running annual deficits exceeding $1 trillion as a new normal. It's not even a crisis anymore. It's just Tuesday.
So we have the toxic triad, a healthcare maze that profits from sickness, a defense black hole that can't track its own money, and a debt bomb that's growing by $8 billion a day.
It's a lot.
If this were a movie script, this is the part where the audience gets really, really depressed.
Right. But this is where the research gets fascinating, and I think weirdly hopeful in a way. It says, don't just look at 2026. This isn't a new problem. If you want to see how this movie ends, you have to look at the ghosts of empires past.
And this is where we go to the Mongols.
The Yuan dynasty, specifically.
I have to admit, when I think of the Mongols, I think of Genghis Khan on a horse. I think of archery, yurts on the steppe. I do not think of central banking policy.
And that is a huge historical oversight. The Mongols were financial innovators. Under Kublai Khan, Genghis' grandson, around the year 1260, they introduced the Zongtung cow.
What was that?
This was the world's first large-scale use of paper money that was fully backed by a precious metal, in this case, silver. It was the tech boom of the 13th century.
Paper money in 1260, that's revolutionary.
It was a miracle. It unified the largest land empire in history. It facilitated trade all along the Silk Road. You didn't have to carry heavy bags of copper or silver coins. You just carried a piece of paper that was a claim check for silver. It was efficient. It was brilliant.
The Golden Age.
For a while. But the research breaks the Mongol currency story down into 3 stages, and it is a perfect cautionary tale, a mirror for our current situation.
Okay, what's stage 1?
Stage 1 is full silver convertibility. This is from about 1260 to 1275. Trust is high, inflation is low, around 4.5%. You can walk into a government office with your paper note and walk out with the promised amount of silver. The system works.
Sounds good so far. Stage 2.
Stage 2 is what the source calls nominal convertibility. This is from about 1276 to 1309. They start running a bit low on silver. They've been spending a lot. So the government basically says, the note is still backed by silver, but please don't ask for it right now. We're good for it. Just trust us.
The trust me, bro stage of monetary policy.
Exactly. The cracks are forming. You can see where this is going. And then stage 3, the fiat standard from 1310 to 1368.
What happens here?
They abandon the silver link entirely. The currency is now backed by nothing but the Khan's decree, and this is where they discover the intoxicating magic of seigniorage.
Seigniorage. Let's unpack that term. Sounds fancy, but what is it?
It's the profit a government makes from printing money. If it costs the government, say, 1 penny to print a $10 note, the government has just created $9.99 of purchasing power out of thin air. It feels like free money. And the Yuan dynasty became addicted to it.
Because they had bills to pay. Huge bills.
Massive bills. They had 2 failed invasions of Japan, their fleets destroyed by typhoons, the divine wind. They had huge, grand infrastructure projects, digging the Grand Canal, building the new capital Daedu, which is modern Beijing, building the legendary pleasure city of Xanadu.
So they're fighting wars and building pleasure domes. That's an expensive combination.
And suppressing constant rebellions throughout their vast empire. How do you pay for all that when the tax base isn't enough? You print. You just run the printing press. By 1310, they had issued 36 million ding worth of notes, a value that vastly exceeded any silver reserves they ever had.
And what happens when you flood an entire empire with paper that isn't backed by anything real?
The value collapses. It's basic supply and demand.
Yeah.
By 1309, the notes had depreciated 1,000% compared to where they started in 1260.
1,000%.
By the mid-14th century, inflation was running at an average of 11% a year. But the social impact was the real disaster. People stopped trusting the money, commerce broke down, they went back to barter trading wheat for silk, goat for tools. The entire economy de-evolved.
And then, on top of all that financial chaos, the Black Death hits.
The external shock. The plague. The economy was already so fragile from the hyperinflation that when the plague hit and wiped out a huge portion of the population, the empire it shattered.
Yeah.
The Ming dynasty rose from the ashes in 1368.
So what's the lesson from the Mongols?
The lesson is that innovative monetary policy like fiat currency is a dangerous weapon. It can be useful. But if you lose fiscal discipline, if your spending gets out of control, the temptation to just print your way out of trouble is almost irresistible, and you end up printing yourself into oblivion.
So the Mongols went too fast. They innovated, they hyperinflated, and they exploded. That's one ghost. But the research points to another very different ghost, one that died a much, much slower death.
The Roman Empire.
Yeah.
If the Mongols were a sudden explosion, Rome is the story of slow corrosion. It wasn't a single event. It was a strangulation over centuries. And it started with their currency, the denarius, the silver coin that everyone in the known world trusted.
It was the dollar of its day.
Absolutely. And the emperors, starting with Nero, started messing with it.
They started debasing it.
Exactly. Imagine you are the Emperor Nero. You need more money to pay the troops and build your palaces. So you take the pure silver coins coming in as taxes, you melt them down, you mix in some cheap copper, and then you remint them. You make, say, 5 coins out of the silver that used to make 4.
It's the ancient version of shrinkflation. Yeah. You get the same size bag of chips, but it's half full of air. You're getting the same coin, but less value inside.
Precisely. And they just kept doing it. Emperor after emperor, each one adding a little more copper, a little less silver. By the 3rd century AD, the denarius, which used to be almost pure silver, was just a copper slug with a thin, silvery wash on top that would rub off in a week.
Did the people notice? I mean, a Roman soldier or a merchant, could they tell?
Of course. Soldiers aren't stupid. Merchants aren't stupid. They could feel it, they could weigh it. And what happened? Prices skyrocketed for everything. Hyperinflation. A measure of wheat that cost 1 denarius in the early empire suddenly cost 100, then 1,000 worthless denarii.
In Rome had a structural problem that the research says mirrors our own defense pillar. Their army was just too expensive to maintain.
It was unsustainable. The research says the army consumed up to 75% of the entire state budget. 75%.
Wow.
And as the Roman citizenship base shrank from plagues and poverty, they couldn't fill the legions anymore, so they had to hire mercenaries. Goths, Vandals, Franks, barbarians.
And I'm guessing those mercenaries didn't want the debased copper coins.
They demanded gold. Real money. So the empire is bleeding its actual wealth, the gold reserves, out to foreign mercenaries to protect the borders, while circulating worthless copper to its own citizens.
It's an impossible situation.
And to try to fix this, they turned to the third leg of the disaster, the taxation trap. As the money became worthless, the state couldn't buy food or equipment for the army with it. So under the Emperor Diocletian, they started demanding in-kind taxation.
Meaning you don't pay your taxes in money, you pay your taxes in stuff.
You pay in wheat, you pay in leather for sandals, you pay in iron for swords. If you're a farmer, the tax collector just shows up and takes 1/3 of your harvest.
That sounds like we're going backward in time. That's not a sophisticated empire. That's a feudal farm.
It was the effective end of the market economy in many parts of the empire. If you were a farmer and the tax collector takes your wheat, you can't trade your surplus. You can't sell it to buy better tools or other goods. Specialization ends. People fled the cities to go back to self-sufficient farms just to survive. The complex, interconnected Roman economy just unraveled and dissolved.
It's terrifying. So you have the Mongols who innovated too hard and printed too much, and it all fell apart quickly. And you have the Romans who slowly, methodically debased their currency and taxed their own economy back to the Stone Age.
And in both cases, the root cause was exactly the same. The government's commitments war, luxury bureaucracy, wildly exceeded its ability to pay for them honestly through taxation, so they manipulated the currency to cover the gap.
Which brings us right back to January 2026, the toxic triad.
The parallels are they're flashing red all over the dashboard.
Let's connect the dots explicitly.
Okay. Bureaucracy and perverse incentives. The U.S. healthcare maze, rewarding volume over value, is the modern Soviet administration. It's the late Roman tax collector demanding more and more for less and less.
Fraud and opacity.
The U.S. Defense Department, failing its audits year after year, is the Soviet military masking its waste and brittleness behind a facade of immense spending. It's a black hole.
And the big one, currency and debt.
The $8 billion a day we are borrowing is the Mongol printing press in digital form. The slow erosion of the dollar's purchasing power through inflation is the Roman debasement of the denarius.
It's the same script, just with better technology and different costumes.
Exactly. And the research warns that we are risking a slow motion unraveling. It's not necessarily going to be a Mad Max apocalypse tomorrow. It's not a sudden collapse.
No.
It's going to be a gradual decline in the standard of living, a decline in national security, a crumbling of infrastructure, and most importantly, a loss of trust in our core institutions.
So is there a way out? Or are we just, reading the obituary of the American empire here?
The research does offer a path forward. It's not hopeless, but it requires what the source calls bold reform and not just tinkering around the edges.
Okay, what does that look like for healthcare?
For healthcare, we have to fundamentally realign incentives with outcomes. Stop paying for volume, start paying for value. Pay doctors and hospitals to make people healthy and keep them healthy, not to manage their sickness. And we have to address the root cause. We have to fix the food system to stop the metabolic poisoning of the population.
That's a huge one. What about defense?
Rigorous, brutal accountability. If a department fails its audit, it doesn't get a budget increase, period. Transparency has to be non-negotiable. You have to be able to count what you own.
And for the fiscal situation,
The debt bomb.
we have to stop the bleeding. It's that simple and that hard. The research argues we have to institute real fiscal discipline to curb deficit spending and stop treating the national debt like it's some abstract number that doesn't matter.
Those are massive political hurdles. I mean, monumental.
They are. They might even be impossible. But the alternative is what we saw with Rome and what we saw with the Mongols. History is undefeated. The math always wins in the end. That's the takeaway for me from this whole deep dive. You can play games with billing codes. You can play games with audits. You can play games with the printing press. For a while. But eventually, the math wins.
The math always wins.
I'll leave the listener with a final thought, a final question to chew on. We tend to think of ourselves as modern, sophisticated, immune to the dumb mistakes of history. But the Mongols invented paper money. They were the fintech geniuses of their day. And they couldn't manage the temptation to print their way out of trouble. And they failed.
Yeah.
Rome was the greatest military superpower the world had ever known. They seemed unstoppable, eternal. And they couldn't sustain their army without bankrupting and destroying their own society from within. And they failed.
Yeah.
So the question is, what makes us think that we, with all our algorithms and our gleaming towers, are immune to the same basic, brutal laws of economics and history?
That is the question we all need to be asking.
If this deep dive sparks something in you, don't just let it go. When you see the news, look past the headlines. Look at the audits. Look at the incentives. Look at the debt clock. Keep digging deeper.
Thanks for joining us.
We'll see you on the next one.